So today, we're going to tackle a really big question in global health. How do we build a health and care workforce that can actually withstand the next major crisis? To do that, we're diving into a powerful roadmap from the World Health Organization that shows why the answer really lies in everyone working together.
So let's just start with the question that I think should be on all of our minds. After everything the world has been through, is our health workforce truly ready for whatever comes next? And look, the answer, it's not a simple yes or no. When you really start digging into the why, you uncover some pretty deep systemic challenges.
And this is a really critical point. The pandemic didn't actually create this crisis. You can think of it more like a giant spotlight that suddenly switched on, revealing all these long-standing issues in how we plan for, educate, and employ our health workers. These were cracks that were already in the foundation. The earthquake just made them impossible to ignore.
Okay, so here's how we're going to break this all down. First, we'll look at why the workforce is at a breaking point. Then, we'll explore a whole-of-government solution. We'll unpack 5 keys to making that collaboration work, see it in action with a real-world example, and finally, we'll talk about why all of this really matters for you.
So, when we talk about the workforce being at a breaking point, it really boils down to 3 main issues. First, there just aren't enough people. Second, the staff we do have are often in the wrong places. Think too many in big cities and not enough out in rural areas. And third, we don't always have the right mix of skills to meet the actual health needs of the population.
All right, so what's the fix? Well, the core message from the WHO is pretty clear. The health ministry just can't solve this alone. And why is that? It's because the root problems, things like education pipelines, fair labor practices, even childcare and transport for health workers, those aren't owned by the health department. They belong to other parts of the government.
And that brings us to this key concept: intersectoral governance. Now I know that sounds a little academic, maybe a bit complex, but the idea is actually pretty simple. It's all about creating a system where the different government departments, health, education, finance, labor, are actually talking to each other and making decisions together. It's about breaking down the silos.
This slide does a fantastic job of making that abstract idea feel really concrete. Just think about it like you're building a house. The Ministry of Health, they're the architect. They draw up the blueprint for the kind of workforce we need. Then, the Ministry of Education trains the builders, our doctors, nurses, and technicians. Of course, you need money, so the Ministry of Finance funds the whole project. And crucially, the Ministry of Labor steps in to make sure the working conditions are fair so we can actually keep those skilled builders on the job. Okay, so we get the what, but the big question is how? How do you actually make this kind of collaboration happen in the real world? Well, the WHO report lays out a fantastic framework of 5 key actions to turn this big idea into a practical reality.
And that brings us to the very first key, and it is all about leadership. This quote just nails it. This can't be a side project. Without serious, top-level political commitment, this idea that the health workforce is everybody's problem, well, it just doesn't happen. It stays stuck in the health ministry.
Right. And that commitment can't just be words on a page. It has to translate into real action. We're talking about a formal mandate for everyone to work together, building workforce planning into every single ministry's agenda, putting real funding behind it, and, maybe most importantly, making sure that commitment lasts longer than a single election cycle.
Key number 2, it all comes down to trust. Collaboration doesn't just happen automatically. The health sector really has to earn its seat at the big table. It needs to show up with solid plans, back up its requests with hard evidence, and prove that it can deliver on its promises.
All right, key number 3 is all about building the actual machinery, the structures that make this collaboration possible and sustainable. And the good news is, this doesn't mean you have to start from scratch. It's often about taking the committees and working groups that already exist and making them stronger and more focused on this goal.
And we can do this in some really practical ways. We're talking about mobilizing high-level cabinet committees, giving existing groups a bigger job to do, directly tying funding to workforce goals, and this is huge, bringing in voices from outside government, like communities and unions, to be part of the solution.
Okay, this brings us to key 4, and honestly, this one is a game changer: data. Think about it. Data is the currency of government. When the health ministry goes to the finance ministry asking for money, it can't just be based on a feeling. It has to be based on solid numbers. It's the language that other sectors understand and respect.
So the big takeaway here is that we have got to get way better at collecting, analyzing, and using our data. We need to be able to forecast what we'll need in the future,
link our requests to very specific health goals, and actually quantify what we need and why. That is how you build an undeniable case for investment.
And that leads us to our fifth and final key, which is really about storytelling. It's about changing the entire narrative. We have to shift the conversation away from seeing health as just a cost on a balance sheet and start framing it as a smart investment that pays off for everyone.
This visual of a tree is just perfect for this. When you invest in the health workforce, you're not just funding hospitals, you're planting a seed. That seed grows into economic benefits, like new jobs in places that need them. It grows into social benefits, like better gender equity. And ultimately, it creates a healthier, more productive population, which is a win for every single sector of the economy.
All right, so that's the theory, but does it actually work in the real world? Let's take a look at how these principles get applied in practice.
Okay, let's look at a fantastic real-world example from Chhattisgarh, India. They did this incredibly deep, data-driven analysis of their health labor market. And look what they found. They didn't just say, we have problems. They identified specific gaps, like high vacancy rates for medical officers, and real concerns about the quality of nurse education. And this led to concrete multi-sector solutions, like fixing recruitment and improving accreditation for schools. It's a perfect example of this whole process in action.
So how do you make sure that kind of amazing collaborative work is actually successful and sustainable? Well, to help with that, the WHO offers this really practical tool called the TAPIC framework. It's a great acronym to help remember the core principles that make all of this possible.
So TAPIC stands for Transparency, Accountability, Participation, Integrity, and Capacity. You could think of these as the 5 pillars holding up the entire structure of good governance. You need transparency so everyone sees how decisions get made. You need accountability so people take ownership. You need participation, integrity, and of course, the actual capacity to get the job done. If one of them is weak, the whole thing can start to crumble.
Okay, let's bring all of this home. If you're a student in health sciences, or maybe you're already working in the field, you might be thinking, okay, governance, intersectoral collaboration, what does this have to do with my daily work?
Well, here's the bottom line. The truth is, it's just not enough anymore to be an excellent clinician or brilliant researcher working in your own little silo. The biggest health challenges we face today cross all sorts of boundaries, so your real, lasting impact is going to be defined by your ability to build these bridges, to work with educators, economists, and policymakers to solve problems at their very source.
And so that really leaves us with one